people are coming in with low testosterone levels.
I got my own theory. I think Gen Z, because of the COVID lockdowns, they didn't have personal interactions.
Yeah.
So a lot of Gen Z just sits home and jerks off instead of
I don't know.
leading to low testosterone levels. There's a good subset of patients or people that'll just go to Google before they'll go to a primary care physician to find out what their diagnosis is.
I've never tried the cream, but I've done the shots. I did microdosing where I was injecting small amounts daily. That was because I knew like the small amounts daily would keep me more even, and I didn't want the highs and lows. And no matter how many people go into medical school, there's still not enough training programs. And if more physicians leave medicine, you're going to have even less physicians teaching physicians.
Welcome to episode 2 of the Doctor's Life podcast, where we'll be discussing a little bit of politics, a little bit of weight loss injection medication.
Yeah, and peptides and stuff that we've tried in our practice, and some of the important roles that people play in our practice as well.
That's right. What pants are you wearing?
Fear of God.
It's pretty cool. Tearaways?
I think
they kind of look like tearaways.
They're fake tearaways. You got zipper, but you can't completely tear them.
If you get like a high-end designer making like high-end tearaway
I actually
pants.
have some Adidas ones, but they don't stay together. So I'd be walking around with my underwear.
They tear away on their own. That's an extra feature.
That's something to let Biden wear during his debates.
It's a weird intro. Like
you want to talk about debate? So there you go. Biden wearing tearaways at the debate. They'd totally get torn off and he'd be standing in his underwear. What do you think he wears, boxers or briefs?
We beat Medicare. Shit, I don't even know where to go from there. It's so bad. I don't know.
I didn't even watch it. I just heard it from people. I'm like, that's good enough.
I watched it. I got a good like hour of like laughs. I missed the first like 15, 30 minutes of it. And I was just like, holy shit. This is actually real stuff. Compared it to debate at the Del Boca Vista, you know, the retirement home Jerry Seinfeld's parents are at, and George's parents trying to get into. It's exactly like that. It was just like, okay, what are two candidates going to sound like if they're running for the head of Del Boca Vista? And it was like, that's exactly what we got.
It was the earliest debate that's ever taken place, right? I don't think they've ever done a debate so far ahead.
Yeah.
Then I wake up Monday morning and the first thing on my news reports and my email is like, you know, are the Democrats replacing Joe Biden for the Democratic?
Swap him out. Swap him out.
He pretty much has to quit if he can remember those words. So
we're in a tough place. Did I say it last week? If your Uber driver comes by to pick you up and he's over 75 years old, are you going to jump in that Uber or just wait for the next one? It's like, you wouldn't settle for that for your Uber driver, but we have to for next president.
The 75-year-old might drive away without you even getting
Definitely 75, better than 86. But
so how was your week? Last week. We worked together quite a bit. So.
Yeah, we did a few free flaps this week, and those days were pretty busy because we each had like a couple cases outside of that or clinic. It was fun. Happy patients. So it's going into clinic and seeing people like interact with you, like so happy with their care is really good. And yours?
Very similar. Well, I started the flaps just like the week before you did all the flaps and I did the cases during the day. I still did cases during the days, but not as much as you last week. I did more of the flaps. But we got more of the flaps this week too.
It's been
At least we get Thursday off. Yeah.
It's been kind of cycling, like who's starting in there, and I'm just like each way. Whether you're doing a case and running into the flap or just starting the flap, you're like, I'm doing a lot of work right now. Get it done, and it's a good time. So we did 2 flaps last week, 2 flaps this week, 3 flaps last week.
Yeah, 4 next week,
2 this week. Just because there's a holiday.
Just the holiday. Well, my wife wants to kill me for taking half a day off.
Happy Independence Day.
Yeah.
You can sleep in an hour.
Well, there's no sleeping in. We have kids, so.
Yeah.
So what do you think's important about, you know, having a practice, running a practice, Like, who do you think's like vital to our practice?
Vital parts to it doesn't need to be individual for each one of these roles, but you need somebody that's just the contact person from who's calling to your office to schedule whatever. The person responding is huge.
Yeah.
After that is having appropriate assistance to take care of calling in scripts, answering questions, just being there for whatever is required pre-op, post-op.
So one of the integral and like most overlooked jobs is like front desk. Just like you go to a restaurant and the hostesses, which like in Arizona, I think we have some of the worst hostess systems. And I don't know, with Open Table and where you reserve your tables online, people kind of lose their mind about unless you have a good manager. I'm like, these restaurants must be losing so much money with like how many people they can put in those
You're
seats.
talking about the importance of the initial interaction.
Because like, you know, you walk in and like there's 12 tables that are empty because they got reservations in like 2-3 hours and no one knows how to fix it, get people in and get people out. So they fill in those seats. And if people cancel and, you know, they're just throwing that out. They're like, oh, we don't have anyone else. You know, that's where we've moved to as everything's moved more towards computerized. And like right now, even they're trying to get us to be automated in our practice or use AI for different tasks, which, you know, certain things AI can probably do a decent job at. But
finish my text messages. Yeah, it's perfect.
But front desk is like such a vital role. It's that person that picks up the phone, introduces themselves, got to be someone that's positive and knows what they're talking about too. Got to be smart enough to talk about the different aspects and bring your patients in. The other roles are, you know, I never thought about the patient care coordinators and stuff until like a year and a half ago. You know, we always had someone that talked to our breast cancer patients, but like to bring them in as part of your like cosmetic team and to have them reach out to the patients. And like what people don't get is like you pay for these leads and we continue to market and advertise, but you don't have the appropriate people to bring in these patients so you can see them, or the quality patients, and you're spending all this money on marketing and bringing patients in, or social media, whatever you do, however you market yourself. You know, our practice, we spend a lot. Some practices spend 10 times to 15 times what we spend. They're spending like $500,000 a year or $1 million a year just in marketing for like one plastic surgeon. That's huge when, you know, you might make 2 to 3 times that, but that's also, you got a lot of overhead expenses on top of just the marketing. So, you know, you got to have the right people in position. You got to have, and all these people got to work together.
One thing might not be clear from what you said is having the people in the right positions, because you can have the leads, but somebody along the path drops the ball, right?
Yeah.
So you have the leads, you have to make sure you make most of each lead you get to make sure they show up to clinic and hopefully book a case.
Yeah.
So a lot of people in that process from like, okay, I got you like 100 leads, but you don't have a system set up from getting them from the lead to converting to scheduling for a case, then it's like just worthless.
Exactly. And you got to have appropriate training and appropriate people you got to have someone that overlooks everything. And sometimes it's not a manager that's in the office. It might be other training guides that can help you like manage that and make sure you go over that and you see what you're lacking in or what you're missing out on certain patients, and try to fix that and try to improve it in every way. And one of the ways I've been trying to improve everything is like patient outcomes, you know, with like how we do our post-op care and trying to improve our post-op care little by little, adding little things to the office. You know, at first it was supplements, peptides, weight loss, you know, adding hyperbarics, adding vibration therapy, adding red light and pulse electromagnetic frequency. And all this stuff is part of it's anti-aging and part of it's for me, but it also like, you know, as I've been doing it more for me, and then there's all these studies that are coming out in plastic surgery world saying how important and effective they are.
And I'm big on research, so
Yeah.
I'm just like, oh, what's he doing? I'm come to the point where I'm like, okay, if Ruse wants to do it, he's definitely done his research. Like, I don't need to like fact check him, because I like to like dive deep also. You know, like, oh, is this right or not? After like 3 things you said, I was like, okay, yeah.
Yeah, and it's months and months of, you know, it's what intrigues me. So it's like, it comes as a leisurely thing. I don't watch TV. I don't party. I don't drink alcohol. I don't do any drugs. So it's like, you know, my leisure time's either with my kids or reading articles. Sometimes my wife's like, you're on your phone. What are you doing? I'm not texting anyone. I'm just like reading articles about, as she thinks it's like stupid stuff. But I'm like, shit, it makes my brain better. Like we were talking about was the like NAD. We took the NAD nasal spray.
Yeah.
Man, that stuff, like it gives you superpowers, right? How did you feel on it?
I feel great. I just hope it doesn't end up being against the law in like 2 months, and then they're going to have this on tape. Be like, oh, you guys are promoting an illegal drug.
Yeah, like, you know, taking Adderall before taking modafinil. I think modafinil was a great medication, but like this NAD, like just how you function on it and that energy and like just super focused.
Clear.
Yeah.
I think it's just clear mindset. Like that's the thing I took away from it the most.
Yeah, I was like, oh, what is this? Because you hear NAD, they want to give you IV, you take it or like, and you feel the difference when you actually take these supplements. Like we take the Thorne Reservacel, the stuff got resveratrol and NMN. Is it NMN or is it
NMN?
Yeah, it's got NMN in it, and that thing, like you feel the energy right away. You just feel clearer once you take it. And like, you know, I was like, all right, let me just try the nasal spray, see how it is. And it was just fire. And I was like, Rod, you got to try this stuff, because I'm operating and I'm like my eyes were better than the CT scan when I'm operating, you know, under the microscope. And
I used to get up, have like my quad shot of espresso and get my day going. Now it's like 2 shots of espresso and the nasal spray. Let's roll.
The other thing I take as a nasal spray that I think, you know, for a lot of people, I'm already passionate about what I do, but it's made me even more passionate, is like oxytocin. And I read all the good stuff about it. Some people don't believe in the whole nasal spray, and they don't think you can take it exogenously and makes you think differently. But I think it's a great medication to just like, they say you can get the same effect with like an 8-second hug from someone. You get that oxytocin release.
So you get the 8-second hug in like a nasal spray format?
All day
That's
long,
awesome.
Almost. So, and there's like added benefits other than the good feelings that you get from it. It's just like the mother, how the mother loves like the new baby. They get lots of oxytocin release. And that's kind of the way. And then it also has been shown in elderly population that it helps them preserve their muscle. So I was like, I mainly took it to preserve muscle while I was on semaglutide, but like I was like, no, this stuff feels much better.
I remember you telling me, like every time you start something, you're like, hey, this stuff like feels pretty good. Like I'm feeling good about myself, like performing at my best, like making sure like I'm taking care of myself the best I can be. Yeah,
and like I've just learned my body, like, you know, I do pellets and for hormone replacement for testosterone. I did so much experimenting and like studying on that topic. The male thing, I got, you know, there's people that are like, oh, pellets are the only way to go. There's people that say shots are the only way. People that say creams are the only way to go. I think they're all great options. It's what you want, you know, like some people are afraid of needles and don't want to do needles. And like I've had friends that I've prescribed testosterone cream. They think it's the greatest thing ever. And, you know, I've never tried the cream, but I've done the shots. I did microdosing where I was injecting small amounts daily into the sub-Q. That was because I knew like the small amounts daily would keep me more even, and I didn't want the highs and lows. I had done the IM injections once to twice a week. That you get a high after 48 hours, but then it dips down, and then you're on this roller coaster all the time.
Do you think you ever went over like where you should have?
At the beginning, because I was dumb and like, oh, let me do this.
More is better.
Well, you respond quite a bit when you originally start. Then, like everything, if you're doing a lot of it, then you need more and more. And like at the beginning, you should start low and then go up. And that's the way we do the pellets, is usually start out lower than we actually need. So, you build up to higher level as you need it. Because if you go too high, then that spills over to estrogen.
It burns out receptors. Your body just doesn't respond the same way to it.
You also, like, when you're overshooting, the good feeling that you get from testosterone, like the clear mind and better sleep and more energy, that all of a sudden becomes moody and you don't have as much energy. Your clear head's gone because you got all that's getting turned over to estrogen, and your body can't tell, you've kicked it over. So even though you have high testosterone, you have higher estrogen levels that are going to, crush you. And like even, with pellets, if you overshoot it, it's going to be the same thing until those pellets kind of start running out. And that's the way we treat most of the patients with pellets. When do we know to put in new ones? You can't see it. Well, I can feel mine, and they usually go down by the 3-month mark. But like I usually need to get new ones placed at about the 5-month mark. I'll notice I won't sleep as well. I'll notice I can't do as many reps. I do resistance bands, and I can't do as many reps. Or, I have to go on lighter bands. The clear mind's fine, but energy starts decreasing. So those are ways like you can kind of tell to replace the pellets and stuff. And nowadays it's like earlier and earlier, just due to the American diet and everything, that people are coming in with low testosterone levels, or like they've gotten on hormone replacement way too early and they've kind of shot their system down. So that
I got my own theory. I think Gen Z, because of the COVID lockdowns, they didn't have personal interactions.
Yeah.
So a lot of Gen Z just sits home and jerks off instead of
I don't know.
Leading to low testosterone levels.
Low testosterone. You'd have to do that a lot. Is there a study on that?
I don't know.
You'll have to look that one up.
Yeah.
We could talk about it next time. It's going to be Gen Jizz. All right.
One thing that I can't stop thinking about is the inevitable shortage of physicians in the U.S. coming in the next 5 years.
Yeah.
What do you think?
Dude, talk about inevitable. It's like I just read a paper the other day, and you know what's scary is like, especially the behavioral health sector is probably going to get hit even more, and especially those low-funded, which, in the U.S. they're trying to protect those, and where reimbursements become higher for like your primary care, your family physicians. But a lot of those people are leaving that sector too. There's two people that are causing problems. It's your private equity firms and your insurance companies. So there's like Optum Healthcare, not just Optum, but Cigna, like all of them are trying to take over all these physician groups. And then the private equity groups are coming in and buying these physician groups and just combining everyone. And, like a lot of these groups are run by one or two people, and they don't give a crap about anyone else on the team. And it's
about the shareholders' return.
Yeah. And it's, and when I built my practice, I plan on, because I trained in a big group, and like I wanted to build a big group. And like my thing was I wanted everyone to be on their own and to be successful on their own. I was like, no matter what, I'm going to be successful because I'm going to work hard at it. And these people, I'll just bring them along. If they want to work hard, they'll be successful. If they don't, but like never, like even if I did private equity, which is never going to happen, would I like sell out like everyone else, like these dermatology firms that, like there's two people that rack in like $100 or $150 million selling the practice. And then they leave all their associates, which is like 20 physicians and like 10 nurse practitioners or something
for multiple years.
Oh yeah. They're signed on for multiple years. And then all of a sudden private equity is like, oh, we're not making that much money. You got to take a pay cut. But like now someone else is in control. And guess what? Those higher ups in that group, they just got to sit on the board for a couple of years while everyone else has to like cut corners to treat patients in private equity terms or in like the insurance terms to be able to.
I think the simplest way to think of it like is it's you got another middleman.
Yeah.
Like, okay, I'm going to make sure this works for you, but
yeah.
I'm an additional layer to like extract some type of value.
Yeah.
And it's already like the most expensive care in the world. So
yeah, the population's growing and physicians are, no matter how many people go into medical school, there's still not enough training programs. And if more physicians leave medicine, you're going to have even less physicians teaching physicians. So how are you going to make up that ground?
It's the anti-growth.
So what happens? So like in Arizona, it's kind of crazy, but they start to put, your CRNA who has 2 years of schooling to do your anesthesia. Are you going to let a CRNA do your major surgery or even like half a surgery?
Not without supervision. Not without supervision.
Yeah. Sometimes you do have good CRNAs. They've been doing it for 20 years, but you can't give them the right of way to, control the case when they just come out of school. So what, like they're coming out with like the certain amount of hours they need to have. And that's turned over. NPs already had the rights because they did extra schooling and everything to be able to, but their role is more as a primary care. And it's not in the surgical aspect. So they're not operating on you, but still it's not the same schooling as your physician.
So that like comes back to like something I've been thinking about, because if you're going to have a physician shortage, the first place it shows up is like primary care, right?
Yeah.
That's why the things
and primary care is your regular physician, and sometimes even your psychologist. Is it psychologist or what is the medical? Is it psychiatrist or
psychiatrist?
Sorry, I don't know.
Behavioral therapist.
Behavioral therapist.
Yeah. Canine therapist.
Yeah.
So yeah, you talk so much, like I'm about to say something and you just keep talking. I'm like, fuck, I lost what I had something really good to say.
If it was good, you remember it. So,
yeah.
But
so yeah, like you're a primary care physician and like the shortage of it. And we started off this discussion with like AI, because AI, NPs, PAs, CRNAs, physicians, extenders, these are all ways to get more out of one physician than you can get, right? And so people argue that like, okay, we can make up for that with increasing mid-levels, which I agree with technology like AI. Like there's a good subset of patients or people that'll just go to Google before they'll go to a primary care physician to find out what their diagnosis is. So at least it's good to know that like it's getting better. So if you're going to diagnose yourself, at least you're getting closer. Is there anything else that leads to like the growing physician shortage that people aren't paying attention to, or the government isn't? The changing demographic where we're getting older, the whole population, like majority is going to be like elder, people are living longer.
Well, we're trying to make people live even longer. So, and preventative care is going to be where it's at, and a lot of people are getting into it. And as we're discussing, like there's people that don't even have a medical degree and they go and shout and holler and like make like podcasts and social
I'm
media
going
posts.
to, if this doesn't work out, if plastic surgery doesn't work out for me, I'm going to become a holistic veterinarian.
Yeah, good for you.
I'll fucking tell you what to do with your pets, and I have no knowledge on it.
You just type it into the AI and you can.
I'm a naturopath.
Yeah.
I'm a doggy naturopath.
So there's a lot of people out there that talk about this stuff, and you got to just take all that info in. But for non-medical personnel, it's going to be a lot harder to kind of see exactly what makes sense and what truly to believe. And with a lot of these people that make the podcast, once they start getting sponsored, and they start talking about stuff that, like, sometimes it's stuff that they believe in and they use, but sometimes you're like, all right, this kind of, it's foo-foo. You look at the label and you're like, all right, there's no real studies behind all this stuff they're saying. Huberman, who, he has good podcasts and talks, but then you see some of the stuff, like especially some of the stuff he talks about, like, raising your testosterone without, like, actually getting testosterone. And these people are riding it, and I'm like, that doesn't do anything. I'm like, go and check your levels. It's not improving your levels,
It's not practical.
Yeah. Yeah. So it's understanding where they're coming from and what they actually know. Like Huberman, like he does a lot of, he puts out a lot of the studies out there, but he also, like, he spits out like 10 commercials before he starts his podcast. Like Peter Tia, he's great, and he's done a lot of good podcasts. I like his, and like the people he brings on are truly experts in what they do, and he talks about a lot of the research behind it. So, but it's like taking bits and pieces from a lot of different people and going to these different conferences to learn about a lot of this stuff.
Put it all together.
Yeah.
In your own way.
And what are your feelings about the FDA?
I'm like on the inside, like ultra libertarian and anti-government, or smallest government possible.
Yeah.
So FDA, in what regards? Approving like medicine, like which part? Because they're kind of like, that's the first reason I don't agree with having one organization that takes care of that much, because that should be split up into a few different groups. It shouldn't all be like overlapping. That's the first thing. Because food and drug,
and I think
that covers a lot of stuff.
And in medicine, that it covers a lot of stuff, but in medicine, it also puts you at legal risk when, like, what they do is foo-foo. Like, some physicians might be doing foo-foo stuff, but like there's stuff that actually is well studied, and the FDA is like, oh, we feel like this isn't good enough.
Well, they haven't gotten around to it. Like, they're like, okay, it's not an FDA approved study. It's like, okay, like, so yeah, it's not ideal. They're very slow, just the process. Because if you're going to get a medication approved by FDA, going from research and design to getting FDA approval is generally like in like hundreds of millions of dollars. So it's each one.
When they got like Eli Lilly giving them billions of dollars to approve like their their thousandth drug, you think they're going to back anyone else?
Which pharmaceutical has the rights for the anti-hepatitis medication?
It's a smaller company, isn't it? Or is it MERS?
I don't remember, but I just like following their like stock price, and they released like once in a generation type of medication. I think once in like top of the decade type of medication, because it just crushes hepatitis after 12 weeks. And they put out this like revolutionary medication, and their share price is tanked. It's like completely like unrelated to like the type of effect they're having.
Is it something people have to take for lifelong, or
no? 12 weeks.
12 weeks. Okay.
12 weeks. The first hepatitis medication.
Well,
that's where I started getting risky with needles. Like I didn't care about poking myself during cases. No, I'm kidding. I was like, there's a cure for this now.
No, and I got stocks in the big pharma, and like I've done great with it, but like, it's just, they're backing up the FDA, and the FDA is like, especially the peptide stuff. How many patients have I had like they're like, what am I going to do? They don't have injectable BPC. And, that's gotten rid of all their back pains. They they used to be bedridden and stuff. And the only thing
multiple
that's
admissions,
worked,
all types of expenses.
Yeah. And like CJC, I went off was cycling off CJC, ipamorelin. I still have my places to find it legally. And on the black market. But, like this is stuff that, better sleep, better health, especially when they need patients to lose weight with like Ozempic or semaglutide, tirzepatide, whatever they're losing weight with. And to keep their muscle mass is going to be so important. And like people are just going to be withering away. And when you have something that you can keep people's muscle mass, it's going to be very important. And like, not does it just do that, it also helps them lean up even more. That would be like a deadly combo. And, that's off the market for your regular population. We're still able to get it from different compound pharmacies, but a lot of pharmacies are closing down what they can do with it because, the FDA is going to put out a notice that, it's not illegal to have it, but they have the right to go after the compound pharmacy, the rights to go after the compound pharmacies that are distributing I forget, it's like 12 banned substances. And, Ozempic and stuff, I think didn't get banned because one of the main things, or semaglutide didn't, because the big pharma is pissed at these compound pharmacies making the semaglutide because there's a shortage. And the main shortage it's not the shortage of the drug, it's the shortage of the needles they made, the proprietary needles, so you could just inject once by the two different drug companies. They couldn't make enough needles to do the injection. So they were kind of pissed. So, but if they went just after semaglutide and tirzepatide, they knew like people would be like, oh, they're getting funded by big pharma, so we got to stop doing this. One of the medications that I used for tanning, but it also like it's not just for tanning because like they're trying to use it in people that are light skinned to give them the Donald Trump look. And what that does
crispy.
It actually decreases their risk of getting sunburns, and which decreases their risk of getting skin cancer. So on top of that, it does increase libido. So overall, good medication. I don't say it's a great medication because it does cause quite a bit of nausea, but that's over pretty quickly and you get great response with it. So
okay, so what do we have for
weight loss?
Ozempic versus tirzepatide, and then additional receptors, and what do they mean? Because you start with the GLP, and we're going to continue to see this, right?
Yeah.
Like
there is a third drug that's available through certain compound pharmacies already.
And so the name is
retatrutide. So it's part of the same GLP-1 family,
but it has a GIP receptor, right?
GIP, GLP, and it's also glucagon. So it's going to increase your metabolism. You're not going to hold, and like it's actually supposed to be better than the other two with increased weight loss, because with semaglutide, the 6-month studies showed about a 15% total body weight loss with Ozempic, where your tirzepatide patients are going to lose up to 20 to 22%, where retatrutide, you're going to lose about 24%, which is comparable to, bariatric surgeries between 20 to 25% total body weight loss on it. So when you got a medication that's that close, and phentermine was the greatest thing before this, was 8 to 10% total body weight loss. So when you got these things, instead of needing to do surgery, it's great medications to come out. And not only do they, suppress your hunger, they make you think differently about food, but they're being studied for tons of other things benefits that it's helping out. Yeah. That's ridiculous. And well, the main thing, they're out for diabetes and glucose control and decreasing your hemoglobin A1C. And guess what? The primary care physicians are still scared to give it to patients. They tell them to go on diet and exercise or put them on diet controlled diet. I'm like, you're already diabetic. Your kidneys are already getting a shot if your hemoglobin A1C is
and
that
every
high.
day having that kind of floating A1C level.
Yeah. So why are you letting this person damage their entire body that they've already been damaging? They're pre-diabetic. They've already started most of the damage, like increase their risk of Alzheimer's, cardiovascular disease. So, you give them something like Ozempic, they start losing weight. Losing weight, the ways it's good for you is, fat contains a lot of inflammatory products. So if you decrease the fat, you're going to decrease inflammation. And then with Ozempic, you're also going to get, they're studying it for osteoarthritis. One of the things is decreasing weight. You're going to decrease the weight bearing on those joints, but also it's anti-inflammatory. So it's going to decrease the inflammation in those joints. It's not going to repair those joints. Like if you already got bone on bone, you're not going to be like rejuvenated.
Yeah.
There's other products that you could use to possibly help you out with that, but
get a nice layer of Ozempic between the knee joints.
Yeah, or it just becomes fused together. But cardiovascular risk, it's so important, and they're putting so many people.
So I think a lot of people are underestimating the cardiovascular risk reduction. Because those are your top killers, right? Outside of cancer.
Any patient that has an MI should be put on this.
Yeah.
Like pretty much.
Agreed.
Like, or if you have high risk in the family of MI or stroke or any vascular disease, like should be put on this because this sort of helps decrease the inflammation. Kind of starts to reverse atherosclerosis. You're not building up the inflammatory products. It makes your vessels more elastic, so you don't have the hypertension.
Just overall homeopathy.
Yeah. Well, one of the parts is as your vessels harden, your blood pressure goes up, right, and you start doing more and more damage to your kidneys, your liver, everything.
And it becomes irreversible after a certain point. Like you got to stay ahead of it before you have a serious issue. Then you can that's where I think right now, at least the stage of longevity and longevity medicine it's like extending your good years. Because once it gets bad, you're not going to be able to do much to change that up. Yeah.
So it's going to change heart attack, stroke, and then also building up plaque for Alzheimer's and early onset dementia.
You say it's funny. People just throw that around. And it's oh yeah, I heard it's decrease the risk of heart attack, stroke. It's significantly decreases your risk of dying of one of the most likely causes of your death.
Yeah. So, how crazy. It's so crazy. You think it's a great drug. And then you hear everything else about it too. More recently they've said reverses chronic kidney disease or prevents it. And part of that's due to the anti-inflammatory effects. And one thing that more and more people have and that don't know they have is NASH, which is non-alcoholic steatohepatitis or fatty liver disease. And they're not drinkers. And what this is going to lead to is if they continue with their bad diet and being obese, it's going to lead to cirrhosis. And with cirrhosis, you just live a miserable life. You're tired. You're going to need surgeries and early death. It's just bad. So the Ozempic can reverse some of the fatty liver as you lose weight. So, and this medication you inject once a week.
Fatty liver technically does reverse with loss of weight, right?
Yeah.
So that's an important part. It's those changes aren't permanent.
Yeah.
And you can do something to really make sure your liver is healthy as it could be.
Yeah. And the other crazy thing is where it's getting alcoholics off alcohol. And that's a big thing my patients say. They're I used to sit down and drink a whole bottle of wine at night. And they're I can barely finish half a glass, or like they're like, or drinking a
Sir,
six-pack.
that's because it's not wine, it's tequila.
Yeah. Drinking a six-pack, going down to drinking one beer. And it just, that's where, like all the different effects it has, all the different receptors in your body, it affects and helps improve overall.
I know how big this is going to be because how much like my macroeconomics podcast I listen to, and it's like how many times Ozempic gets mentioned because it's changing everything. On Odd Lots, there was like, I forget who came on, but she was like explaining like the snack preference has changed with people on Ozempic. So since you're going to be like eating more, consuming less, you're more likely to choose a healthier thing to nibble on, which is kind of crazy. I haven't like seen that in any type of context, but like, oh, they're more likely to have cucumbers than potato chips. So it's huge. I think those are huge.
So there's a lot of added benefits, and the ways it works is it works on cells in your brain, so you think differently about food. It slows down your intestinal tract, so you get full a lot quicker. And then another way is it increases the insulin secretion from your pancreas to break down the carbohydrates. So those are ways, and that way it controls your blood sugars. If you don't have a problem with going hypoglycemic already, this isn't going to make you hypoglycemic. It's going to just moderate your sugars. So they're not going to go all over the place. And the other medications, they just add potency, and they work on different receptors. I think I feel much more full when I take tirzepatide as compared to semaglutide. And
how could you feel more full?
Like I feel like my stomach just like shrinks down a lot more with it.
Somehow. Like can't fit anything in there. I've never taken it, so
it totally feels like I can't fit anything in there. And the thing you got to talk about is, there are side effects with it that, worry some people. Most of my patients that take Ozempic, tirzepatide, or semaglutide usually don't have much of them. Some of them do get nauseated, but usually when they get to the higher doses, and that's why we titrate it slowly to get them to those doses rather than going at the high dose itself. I actually tried everything, like all the peptides.
That's why I just asked you rather than
even the semaglutide, like, I was actually doing a case with him, and like I took full dose because I've taken all the diet medication in the world, and I'm like, I'm immune to this stuff. I don't lose weight. It doesn't give me jitters.
Can I tell this story?
Nothing's going to happen.
Can I tell this story? The way you do Ozempic, semaglutide, you build up the dosing, and you start at small dose, double it again, and
every 4 weeks.
Every 4 weeks to get to your ideal. We keep ramping it up until you get to your ideal weight, and then we start like tinkering it down because we want to give you the minimum dose possible. But this guy came in, just took like full dose in the operating room. So I was just like, "Are you okay?" He's like, "Oh, I think I got to go throw up." I'm like, "What's going on?" I was like, "You haven't been drinking?" He's like, "Yeah, I'll be back." Just yakking up a storm because you thought you were too
Yeah, I did. I was like, I didn't know, like, and I read a lot about it before I even start taking it, but didn't like really look into the side effects because I'm like, nothing really touches me. I've taken everything, so I didn't think, and I was like, man, it was miserable. And I had I think a half a tuna sandwich, not even, and I felt full, and that didn't last too long. So I went all the way from the start and went back up. But, the other main thing is constipation. It does slow down your GI tract. But, that's the one thing that people don't understand. They think they can go and get it cheaper from other places. Some places aren't giving you the real stuff, or you're having to go in there to get the shots every week because they take it out of a big container. You don't know sterility-wise if it's sterile. But also dealing with complications or knowing what happens or what you can do for those complications. I have patients, like they get it from their friend, or they know some nurse practitioner or someone that's handing it out to them, and they get it, or they get samples from some doc, and then they come to me like they're having some complications and they told them to stop it. I'm like, no, you don't need to necessarily stop it. You could, we could supplement, and it's supplements that you should already be taking anyways. Like something we talk about all the time, the daily greens, like to be regular and not get the constipation, like taking daily greens with fiber is going to get you to the appropriate place, and knowing how to dose people.
You really should be doing that whether you're taking Ozempic or not, right? Like everybody should kind of be on that, and this just shows the importance, and like the stuff we like really lack in a daily diet is greens, fiber. The fiber,
it's 30 to 50 milligrams of fiber, which like not many people get. It's even for me, it's hard to get.
It's like, okay,
especially on Ozempic, good luck getting that. That might be your entire
eat chia seeds. That's it.
Yeah, and like dosing wise, you got to, it's important to know and like what your physicians know about the dosing, and like how to, because you could play around with that dosing, and you don't need to go all the way up. I usually tell people, if you're eating half the amount that you usually eat and you're losing weight, stay at that dose. The higher you go up, the more complicated, or the more side effects you could see.
Yeah.
So
prone to side effects. Like you're just increasing the risk of being exposed.
Yeah. So one of the things I've seen more recently is hair loss from this. And what causes the hair loss? It's because you're not eating as many calories. You're not taking in as much protein. I always take, I would add a protein shake, like, because that's the only way you're going to get that added protein and nutrition.
Is there any supplement you can take where if you have hair loss, it's only on your chest?
Chest X. You sell some of that.
I need help.
So for hair loss, take protein. You got to have physicians that know what they're doing, and not just handing you this stuff to lose weight. Like we put you on a scale that tells you your muscle mass, your body fat percentage.
This stuff slows down your gut, and it's legit malnutrition, right?
Yeah.
If you're not taking in the right stuff with the limited calories you're taking in, that's malnutrition. So that gradually builds up over time, certain people at certain levels. But like you want to make sure you're getting the proper nutrition and adequate amounts. So you're not. Yeah,
especially if you're losing more muscle mass than body fat percentage, that means like you're living a sedentary lifestyle. You're eating like crap. You're eating your French fries and bread and taking Ozempic. You might be losing weight, but you're losing it in the wrong place. And good luck getting off Ozempic. You're going to be paying for that for the rest of your life, because what's going to happen is you're going to lose that muscle mass. It's going to be hard as hell to build that back up. You're going to have less energy, and you're doing your whole body a disservice. Your bones are going to be more brittle. You're going to, you're going to be more prone to fractures or breaking your bones, and you're going to reverse everything that you're trying to do well for yourself. So, that's why diet's going to be important, nutrition, exercise, and protein. To keep the muscle mass, I think you need to take non-vegan protein. You need to take whey protein, or I take a lot of branched chain or essential amino acids and whey protein.
What are the most common vegan proteins?
Pea protein, rice protein.
And why do you not want to take those?
So, those you can't store and build muscle from. So what happens is you break those down as energy, and you don't hold them in as well as you do with whey protein. And, Peter Attia had a good podcast on it there's a guy he has that's like this super protein guy. So, if you watch Netflix, they might show this like huge guy that's vegan. Does that happen all the time? You got to have some crazy diet and get some unnatural proteins to be that size. So one final thing is just know who you're getting this stuff from. And, to be able to get on it, get off it. For me, I won't get off it, but like for people that do want to get off it, you got to have the appropriate diet and exercise, build that muscle. So you're not going that high of dosage, and you just lean back on the doses and are able to come off, and your body's able to control it.